Next, we're going to do Gainsland's. The alternate name for Gainsland's test is the pelvic torsion test. We're testing the anterior and posterior SI ligaments, the anterior hip joint capsule, iliofemoral ligament, and L4 nerve. A positive finding is going to be pain in the SI region, pain deep in the hip, or neuro symptoms down the L4 pathway. We're going to have the patient side lying with bottom knee tucked all the way to their chest. We're going to be stabilizing the lateral pelvis. Stress point is going to be on the top of the leg under the distal thigh. The movement is going to be the top hip brought into extension. And then we're going to look for compensations like arching of the back and flexing of the hip. So we have the patient set up. She's side lying. We're going to go ahead and begin the test. I'm stabilizing the back of her leg here. She's got her other leg pulled up towards her chest, and I'm just going to bend back. I'm making sure into extension. I'm making sure to stabilize the outside of the hip, and we're looking for any signs of pain in the SI region, the hip, or we're looking for neurological symptoms down the L4 pathway. Go ahead and flip over to the other side. Cover the other way. I would like you to tuck your knee to your chest. Good, side lying. And then I'm going to take the leg again, stabilizing the pelvis, and we're pulling it into extension as far as I can go. No symptoms. Again, we're looking for any arching or bending of the leg or hip to flexing the hip to relieve the stress. Next, we're going to do anterior impingement. There are no alternate names for this test. It's testing the acetabulum, the labrum, and the femoral head. Positive findings are going to be reproduction of hip or groin pain, and they may report clicking. The patient's going to be supine. I'm going to stabilize the lateral knee. Stress point is going to be about the foot. The movement is going to be pushing the leg into 90 degrees flexion, 20 to 25 degrees adduction, and then a full internal rotation. Compensations is going to be resistance against the movement, hip coming off the table, arching of the back, or trying to avoid the pain. So we're going to start by having the patient supine. I'm going to lift their leg up to about 90 degrees, stabilizing the hip and the foot. And we're going to go ahead and have them at 90 degrees. We're going to adduct them about 20 to 25 degrees and then fully internally rotate. We're looking for any hiking of the hip or eliciting pain to the area. Then we're going to test the other side by coming to 90 degrees, 20 to 25 degrees adduction, and then fully internally rotating the hip. This way, internally rotating the hip. Last, we're going to do Faber's test. Alternate names for this test are Patrick's test or Jansen's test. Structures tested are going to be the iliacus, so as major, anterior and posterior SI joint ligaments, anterior hip joint capsule, iliofemoral ligament. Position or positive findings are going to be the involved leg does not abduct below level of uninvolved leg. Position is going to be supine with the leg in a figure 4. We're going to stabilize the opposite hip. We're going to stress the medial knee, and the movement is going to be pressing down into the knee. We're trying to get the leg level or equal with the other one, parallel, and we're looking for compensations of raising the opposite hip. So I have the patient supine. What I'm going to do is have them go into a figure 4, and all I'm doing is stabilizing the hip and then pushing down on the opposite knee. As you can see, she can't quite get to parallel. Then we're going to test the other side. Again, stabilize the opposite hip and push down. Again, she can't quite get to parallel, so this is going to be a positive on this test.